And he joins us this hour also with Dr. James Nyoro, who is the former governor of Kiambu County. Good morning.
Morning, Dr. How are you?
Very well, thank you. How are you doing?
Very well.
Good to see you again. Karibu sana.
Asante.
And we say welcome again
Yeah, thank you.
to Bonamathenge. We are going to look into a number of these issues this morning. You didn't get a chance to interpret the proverb for us last hour, so let's do this now. Dennis will share, and then we'd like to hear from both of you.
So our proverb today comes from Togo, and I'll just go straight into it. It is better to walk than curse the road. It is better to walk than curse the road. How would you interpret that?
It is better to walk than curse the road. But it is better to, it is prudent to pursue the goal despite the challenges that seem to stand in between me and that goal.
Yeah, well said. Victoria?
Whatever your target is, whatever your objective is, it's always good to pursue it, irrespective of the circumstances that are surrounding you. It doesn't always have to be the correct road. The most important thing is the goal that you are pursuing. And you have to do it irrespective of whether the road is good or not.
Yeah.
Indeed.
Well said.
It's true. You have to pursue it regardless of whether the road is good or not.
Exactly.
Let's get it there, shall we? Okay. Let's look at what's been happening for the last 138 days in the country. We talk about a particular county, but it's the country. Because now we're getting into a state where it's agony. And it still is right around issues of health. So it falls right in areas where you operate within Mweshimiwa, but then also areas where you operated in, and still, from what we see, for all intents and purposes, still will operate in, and that's in Kiambu County, and that's the health situation that we look at. There is an article in the Standard newspaper today, and it's articles that have made its way into all our media across for the last 3 to 4 months. Agony for families after losing newborns amid doctors' strike. The push and pull between Kiambu County government and county doctors as a painful healthcare crisis is unfolding, with expectant mothers and residents lacking access to quality care in public hospitals. For over 4 months now, several families have been languishing in pain as they mourn the loss of their newborn babies, which they attribute to the ongoing doctor strike, now on its 134, settle not 138, sorry about that, but 134 days is what we're looking at now. This is a real situation. No mother or father, no family member is going to lie about the death of their child. If they do, okay. But we're looking at 106 deaths. It's a number of newborn estimated to have died across Kiambu County in just 4 months, when doctors in public hospitals have been on strike. Can we make up these numbers? I don't think so. It would be a cruel thing to do that. So we are looking at a situation for many that is the reality. So doctors have gone on strike because of an impasse between the county government and doctors. And we've seen the Ministry of Health write letters to pull doctors from certain hospitals or facilities because they've not been able to sort this thing out. And they need them to be on the payroll, so go work somewhere else. So that has exacerbated the situation. But more critically is that lives are lost. Children. I don't even want to say that we don't want to care about the others, but children, innocent children, are dying because of this situation. And we don't seem, if anything, what we are hearing is that on one side, the county government is saying this thing doesn't exist. But you can't wish away a dead body of a child. It's graphic, but it's true. Dr. Nyoro, you have sat at the helm of the county government as the governor, the top boss of the county. What would a situation like this, what would it take for the county government to respond to this? What we've heard in response is that it's all propaganda. That's what we heard this last weekend. But can 106 deaths in 4 months just be propaganda?
Well, thank you very much. It's really unfortunate that we are talking about numbers. But those numbers, there are lives behind those numbers. It doesn't matter whether it is 136 or 100 or 2 or 1. It is a body, it is somebody who has lost a child. But you ask how such a situation arises and what needs to be done. And I'll give you an example of the situation we were in during COVID. And a lot of people probably did not know that the doctors were almost threatening to go on strike on daily basis. If you can remember, there were issues of their own health. There were issues, like for instance, one day they came up and said, we cannot use the normal ordinary masks. All doctors must use N94. Those more surgical kind of masks. And what we did was to make sure that we have a rapport. So the first thing that you do is you have a rapport between the health workers or any worker, for that matter, and try and avoid a situation where you will lead to an industrial action or a strike. So the first thing is, when this thing started, there should have been some consultation, and that consultation, after it fails, then you go to the second part where, okay, they may decide that they go on strike, but you eventually have to have a roundtable discussion, and so on and so forth. Now, to have doctors go on strike for over 4 months, really, is a very, very sad situation. Worse still is that the situation now in Kiambu has been politicized. It has become a political issue. You saw the other day the Council of Governors coming out saying there are no babies that are dying, that the situation is okay, that the county government should be left to learn. But on the same day, KMPDU came in and said, no, you have no jurisdiction over what we are talking about, because we are raising certain very critical issues. And that back and forth situation has now crystallized into, it is a political issue. It's members of parliament or the leaders in Kiambu who are talking to the KMPDU officials and asking them to continue to go on strike. In the meantime, the services are going on. We cannot even agree on the number of babies that have died. We cannot even agree on whether the services are going on or not. For a county like Kiambu, which is on news every day, if you fell sick this morning, would you go there? So we cannot assume that things are not, are normal. And therefore, we need to get to a situation where we have to arbitrate this issue. We have to get facts, because some of these things that we are talking about are factual. When somebody dies, there's a whole process of what happens up to the death permit and burial permit and whatever. We have to know whether the services are going on. If you go to Kiambu level 5 hospital today, or Thika level 5 hospital today, are doctors working? Are they working efficiently? Are they surprised? So these are issues that are factual. But instead of really facing the facts as they are, we have tended to politicize the issue. And in the meantime, people continue to lose their life, and the matter is as bad as you are stating it.
And isn't this what we always see in this country? Whether you're talking about education, in this case, we're talking about healthcare, and in the counties. Initially, there was no political conversation around the strike, month 1. Month 2, then you start hearing, okay, so there are politicians who are taking advantage of the striking doctors. There are those who are speaking to their heads and telling them continue, like you're saying. Meanwhile, as we are busy politicking the hospitals where these services are supposed to be rendered, we've heard stories from patients who've gone and have not been attended. Now we're hearing numbers of babies who are dying. And then, like you're saying, rightly saying, we're now having an argument whether it is true. It is over 100, is it 10, is it 20? Are there babies anyway dying? Now the issue has escalated to a political standoff, where now the governor the other day was just saying, and he was speaking in Kikuyu, I think, but loosely translate, saying that, look, there are people who have wanted to make Kiambu a region. There are people who are my opponents, and they're thinking of 2027, who are instigating these things. And the conversation around then healthcare disappears at that level. Is this where we are, where it's politics that takes center stage instead of looking at real critical issues?
It is very unfortunate. The situation in Kiambu is very, very unfortunate. It doesn't have to be 100 children. No single parent should have to lose their child on account of failure to access medical services. A normal delivery does not require a medical doctor. We require midwives who are nurses. In fact, in the traditional setup, we had the traditional birth attendants. A mother delivering a child is not a sickness. It is not. It is a natural occurrence. And I want to say to the leaders of Kiambu, Governor Nyoro, shame on you, all of you, including my fellow members of parliament. If we can fail to come together on account of the lives of people, the people who voted us in, what is this benefit that I will get when doctors in Nyeri are on strike and my relatives and my village mates and the people who elected me are dying? They are suffering because their health is deteriorating. We should be ashamed as leaders in this country if we can allow our egos in this contest about 2027. And I'm asking, who is this who has had the revelation about what the situation is going to be like in 2027? Please, let's call ourselves to order and stop this nonsense. There is nothing else. There is no any other way of calling it. I would have you are my colleagues. We are in the same space. I wish I could have had kinder words to describe this situation. You know, the issue of doctor strikes is not new. When the very first county governments got into power back in 2012, by March 2013, there were issues of doctor strikes. In this conversation, we need to escalate it, especially where strikes by county public servants are happening on account of delayed salaries. What ought to be our policy on remuneration for public servants in this country? And I want to pose to my country today, all of us in leadership, can we have a policy where every public servant in this country is paid on the same day, irrespective of whether you are serving the national government or the county government? They are public servants. If there is anything we need to do as leaders, then that is one of the reasons why we sought to be in leadership. We cannot seek to take responsibility and then fail in delivering that responsibility. We have had a similar scenario, I think, in Kirinyaga, where doctors also went on strikes for months. I think we had it previously also in Laikipia.
Yeah.
We need to stop. This has to stop.
Bwana Nyoro, you have been a governor before, and when you talk about issues to do with the healthcare in the county, I'm pretty sure it came before. How did you handle it? How different was it? And how should the current administration handle the problem? Because we had the county chief officer here together with KMPDU, and they only not see eye to eye on the clauses within the return to work formula, where the return to work formula that you're talking about is on the non-disciplinary measures within that clause. Non-victimization clause.
Yes.
And that is the bond of contention, because the KMPDU says, as we go back to work, we don't want to be victimized. The county says, we are your employers. We will do as we wish. How did you handle it? And for the benefit of people of Kiambu, for Kenyans, because if I have a problem in Kiambu, I would want to go to a Kiambu hospital. How should the administration handle this matter to ensure that Kenyans can access service in Kiambu?
You know, like I've said, and I want to go back to what Mheshimiwa has said, that delivery by mothers does not necessarily lead to death, but we see situations where children are born prematurely, they need to be incubated, They need to be, so, that's really a critical stage. So it may not be a natural birth, as it were, Mheshimiwa. It could be some of those specialized conditions where the child needs to be put into an incubator and taken care of until time is ripe. But, we go back to, Dennis, to what I started off with by saying when COVID came, March of 2020, it was a very, very difficult time, even for us, because nobody knew how the whole situation will evolve. The doctors themselves were feeling, unsafe because they were dealing with COVID patients, and therefore there were quite a number of issues, including the nurses, that they were raising. Remember, you have doctors, which includes the consultants. You also have the clinical officers, you have the lab technicians, and you have the nurses. And each of those, category of people had issues. And for instance, like I told you, there was an issue where they said our health first. How do we continue dealing with these patients and we are not ourselves protected? And, they came to my office and they said, we want to discuss this with you. And under normal circumstances, the first stage is you have an rapport, you have a discussion, you have a round table, and be available to them, listen to them. You also argue, on certain things because some demands may not necessarily be met. Like I remember that time, to get those kind of masks was very, very, very difficult, and even to get from KEMSA. So you argue with them, you discuss on issues that you don't necessarily agree. You can escalate that and say, we agree on A, B, C, D, but on this other one, can we hold as we continue rendering services so that eventually we can decide whether, it is an industrial action or whatever. But for me, the time I was there was not a single industrial action, not just on doctors, including public health officers and everybody else, because you provide that rapport. Now, in case it is not there, and you now tend to, to the action, the strike stage, then you have to be prepared so that you now bring in other levels of arbitrators. And the situation right now in Kiambu, and why we are very, very troubled, is that, yes, and I agree with Mheshimiwa, that there is a problem between the governor and the elected leaders, the members of parliament, and there's a lot of push and pull. In the meantime, when the two
what are they pushing and pulling?
No, even before the strike, there has not been a good working relation between the governor and the members of parliament. You remember there was an issue of a market somewhere in Thika, and both the member of parliament and the governor wanted to put up the market. There must have been a lot of money to put up for everybody to put up a market. So there is that lack of coordination. There is that lack of no working together and all those issues. But under the circumstance, when such a situation arises, my question is, for 138 days, haven't we had an arbitrator? Okay, because we have seen situations. Even like, for instance, during the Gen Z problem in this country,
right,
we saw the churches coming in and saying, we want to arbitrate on this. In a situation like this, okay, where we have disagreements, we cannot agree on figures, we cannot agree on services, why haven't we had an arbitration or an arbitrator? We have the Senate Health Committee, whose responsibility is to provide oversight on health matters. We have not heard from them on this issue. In the past, we have seen the health committee even visit hospitals. I remember there was a time they visited Isiolo, and they had issues with the facilities there, and they raised those issues. So the question really is, where is the arbitrator in this case? Why are we treating human beings like they are not human beings? So there are several ways, Dennis, to answer your question that you go through, and all of them are to make sure that you don't get to the point of the industrial action. If you get into the industrial action, then there are other ways of arbitrating this so that you are, at the end of the day, it is not the people who are suffering.
I'm looking at a post you did, I think a day ago on Facebook, and I was just trying to confirm whether this is really you. And hearing what you're saying, it's exactly what you posted, where the highlight of the issues that are still unfolding in Kiambu over the past several weeks and months. And you are really insisting on an impartial third party that then should step in to mediate and facilitate a fair resolution to the dispute. And I'm looking at the comments, and these are people who are actually living in Kiambu. And it's interesting because then we're zooming out and saying, okay, what are the people then reading through this? Because the Council of Governors has actually said, look, let the governor continue working. It's almost as if then those in leadership at the moment don't see a big problem. However, the residents from the comment section on your your post, are actually saying Kiambu's problem then is the governor. Because like you're saying, during COVID, you have to sit down and just have a conversation, even if there's no resolution. So far, what the doctors are saying, they've never had even their text messages answered. No calls. But what the residents then are questioning, where are our MPs? They've also gone quiet. Where are the MPs?
You know, it is so easy to want to focus on the personality, the governor, the doctor, the MP. Look, strikes are as old as pre-independent Kenya. Our labor laws are clear. Even in court, under the Labor Relations Court, there is provision for court-appointed arbitrators. So you see, the reality is that the mechanisms are there. It is the unwillingness of the combatants who are not. The battle is not about the common person in Kiambu. It is not about the health services of the Kiambu people. They have just become the perfect excuse for the battles to be escalated. And that is what I'm saying. It is a shame. It is an addiction on us as leaders. We must stop. You know, the political arena is always open. The fields are as many as volleyball pitches in the countryside at every shopping center. Let us not pull our people into the battle.
They're already in the battle, Mheshimiwa. The battle is, and unfortunately, there are very many casualties. That the battle is being fought, and it's going very quickly into a full-fledged war here because of what we've clearly established as what could be a politically incited ego issue, whereby we don't want to come to the ground. But it's already late because people are dying. That today, Wednesday, as we speak, there are people who need medical care and are going to neighboring counties to seek health care by a doctor.
Whenever we have had issues around health services in the central region, Nyeri County suffers. Because historically, the Nyeri County Referral Hospital, previously known as Provincial General Hospital Nyeri, is the natural refuge center for people seeking medical services in the public sector in a premier public facility that has largely all the specialists that are required. And here, the Constitution is clear. The mandate health services in the counties are devolved. Schedule 4, Kiambu County government signed for the devolution of health services. The CEO for Kiambu County government is none other than Governor Wamatangi. Irrespective of the political battles, the buck stops at his door. Any suffering that the Kiambu people will undergo at this point in time, he will not escape. History will judge him very harshly on this one. irrespective of the battles he has to fight. And I don't know who tells governors that once, or even members of parliament, or even the president, President William Ruto, he has to know that come 2027, he will have competitors. And sometimes the guys on the rooftops today may not be his most fiercest competitors. By the time it's 2027, the same realization had better hit the governor Kiambu and also the members of parliament. The competitors will come. So the question of thinking that because I am the one you're seeing today, I am going to be your most formidable opponent is a fallacy. So the political competition will come. And that is a message I'm taking actually across the central region, on the Mount Kenya region, that the time for the political competition will come. In the meantime, in the intervening 20 or so months, there is a job to be done. For those of us who sought the responsibility to do this job, please let us do the job.
But Mheshimiwa, the question I have for you, two questions. One, and I think it was raised here, why is it that a technical issue like this doctor strike becomes a political tool for people within the same county, serving the same people. Okay? And these are the people who elected them. Why does it become a political tool? Secondly, you talk about the governor and whether he take responsibility and what. Why should we, after 138 days, still be waiting before either somebody from the national government or from Senate? I know the National Assembly has no responsibility on counties, but we have leaders who are elected by the same people. Why is it that up to today, nobody has even volunteered to come in and arbitrate and bring the facts onto the table and agree this is the way forward, that there have to be a win-win situation between the doctors and whoever, whether it is the governor or members of parliament? Why is it that up to this stage, that has not happened? Health is a constitutional issue. Provision of health is a constitutional issue. And, Article 43 of the Constitution, it is a constitutional issue. And it is not limited to Section 4 that this is devolved. It is a national government responsibility to make sure that such issues are dealt with. Why is it that an ordinary person in Githunguri or in Kikuyu is suffering and we have a national government and we have all other bodies that could arbitrate on a case like this and bring it to an end? I can't really understand.
What would be the go-to solution to this, first of all? Would it be to have some kind of, you've suggested the arbitration, you've talked about, the necessity of somebody to come in and have the conversation. But let's look at it from a management point of view. That the thing that you're supposed to be managing is bursting at the seams, it's falling apart. There's no conversation that's being had. People are sick and or dying. People are going to seek care in other places. What would be the go-to solution today? Now, in crisis, what needs to happen now?
The simplest one, and I followed that a couple of days back, the county assembly, the health committee, at the county assembly had met and wanted to bring together the KMPDU with the management of the county, but that there was an issue. Everything else, according to what I read, everything else was agreed on, except the return to work formula and non-victimization of the doctors who participated, and that they will not be paid their salaries when they. So the first thing to talk about is the management of Kiambu County to realize that this thing is beyond yours. It's beyond anything else that you want to talk about, and bring these people to a roundtable discussion and agree on a return to work formula. That can work tomorrow, it can work today. It is the easiest and the most convenient in terms of tackling this issue. Beyond that, I think the second level, and this is not mutually exclusive,
Yeah.
is for somebody, like I'm saying, to get interested and say, look, we cannot allow this to continue. And therefore, whether you like it or not, we are coming in, come with your issues, you as a county executive, you as a KMPDU, come with your issues. Let's sit together. Let's work out a return to work formula, which we can supervise over time. It's already happening in Egypt with Hamas against Israel. If it can happen at that level, really, I don't understand what a small strike in Kiambu would be compared to the problems that are being faced at that
And yet,
level.
we have the MCAs. We have the members of the county assembly whose role is oversight.
It is.
But there's pin drop silence that comes from the county assembly on this for the longest time. Nobody said anything about this.
And I can tell you that the county assembly that I worked with, I came in half the way. The county assembly that I found was a very, very strong county assembly. They were really holding me accountable on many, many issues. You could hear that the health committee, for instance, has visited a facility, and they are calling me, asking me why there are no sufficient supplies, farm and non-farm, and so on. So, under normal circumstances, even before you go to the health committee of the Senate, or even before any other arbitration group, the first one lies with the county assembly.
Okay, so the county assembly, which Kiambu County has how many? I'm sorry, Okari, I know that there's a question coming in.
60 elected, and I think there are 86 or so.
Okay,
of them.
86 members of the county assembly, right? They're the appointees of the governor, the CECs. How many of those we're looking at?
No, they are probably about, what, 12? 12
12?
or so?
Okay,
10 to 12.
86 plus
CECs,
12.
yeah.
We're now at 98.
98.
Then there's the governor and the deputy
And they are
governor.
CEOs, they are chief officers.
And then the chief
Yeah.
officers, how many are we looking at?
Equivalent to the department, so probably another 12.
Another
or so.
12. So
Yeah.
now that takes us to 102.
102.
Yeah.
Plus the governor and his deputy, 104. Our one
Plus advisors, right?
Plus advisors.
Yeah.
Plus the county public service board.
But yeah.
So how many are we looking at here? How
Well,
many?
probably 150.
Okay, let's go.
For
150.
the sake of argument, yeah.
150 people, give or take, if we're going to go by KNBS standards, these represent a unit of at least 4 other people, because you're going to say that the basic unit is 5 people. So let's give that another 150 times 4, takes us to 600 people.
Yeah.
All right? I'm going somewhere with this. So are we saying that 600 people today in Kiambu County are not accessing medical care? They're not going to hospital. They're not getting checked up by a doctor. Or where are they going? Where would you go? Would you go to the county referral hospital? Would you go to the clinics within the county, the public clinics for which there was oversight by government, and in this case, the county government? So if things are at a standstill in the county, and these folks are all going to these medical facilities to get treatment and or consultation by a doctor, if the thing was falling apart and that's where they went, perhaps we would have seen that this arbitration that you speak about, this oversight that was necessary, this action that was needed to stop this thing would have been addressed by now. But there's the problem. These folks don't go to these medical facilities. So they couldn't care less if the thing was going up in flames, because they don't go to these facilities. And that could be a problem. No?
It's a big problem in Kenya, and I'm sure Mheshimiwa knows that people who supervise over certain services do not derive those same services from the institution they serve.
Yes,
and you said very clearly, the county assembly has their own insurance provision
Private.
by a private provider, the same with the whole of the county executive. So it's and it's the same if you look at the cabinet secretaries. If you look at all of them do not necessarily go to Kenyatta or to KU referral.
Did you used to go to
wherever.
Sika level 5? Did you?
Well, I was
Did you?
treated whenever I had issues. Like for instance, we did vaccination. I was vaccinated in Kiambu. Whenever I would have an issue, I would call the doctor at Kiambu and say, "Can you please come on this and that?" Because I would not necessarily walk
Yeah.
into Kiambu Hospital,
Yeah.
and I'm seen to be examine my blood pressure. It will be on
The next
social
thing is
media
gonna
that
say
the
that you're
government,
sick.
the governor is falling dead.
Yeah.
So yes, but I had an insurance cover. Okay, an insurance cover, my personal insurance cover that I came with from wherever I came from, but also a provision within the county.
Right.
So it is true that when these guys were to be attended by the same doctors with the same facilities, there will be provision of non-farm, there will be provision of pharmaceuticals, there will be provision of services, and they would also be differentiating between which doctor is better than the other because he
Absolutely.
treated me nicely. But unfortunately, it's not there.
And if
I don't
the
know
doctors that they're treated by said they're going to go on strike tomorrow, I can bet you they'd be having a conversation by noon and have it sorted out. But why this can go on for 134 days is because the folks who are supposed to be doing something about it are not being treated by these doctors,
and not
so they
recipients
do
of
not
the
care.
services. You know, one of the most interesting things, Kenyatta National Hospital and Nairobi Hospital are separated by Gong Road.
Yes.
The only thing standing between the two of them is Gong Road. On this side of the road, you have where everybody in this country goes. Everybody who is who. Across the road is the hospital where anybody else in this country goes. The crisis in our health sector today, and here I want to speak to myself, to His Excellency Nyoro, to our President. We have a crisis at Nairobi Hospital today.
Yeah.
It is not different from the crisis we are having in Kiambu. Unless we wake up and come down from the loft where we are living, we are going to suffer the same fate that the residents of Kiambu are suffering today. Mark my words. So as we think about intervening in Nairobi, and if we have not thought about it, it is time to intervene. Let us intervene across the board. In Kenyatta National Hospital, the renal unit, the burns unit, they have been under construction, I don't know for how many years. The oxygen plant that is supposed to serve Kenyatta National Hospital, and I don't know how long an oxygen plant is supposed to take. But because somebody sitting at the ministry decided they would execute and float and award a tender for an oxygen plant at Kenyatta National Hospital, to date, 5, 6, 7 years down the line, it is non-operational. You know, I don't know the justification that we can have for this kind of things happening while we are in leadership.
You know, Mheshimiwa, when we talk about these issues, at the end of it, when you connect the dots, is a Kenyan. There's a life at the end of it all. There is, as we are talking here, we're talking about over 100 lives that are lost in Kiambu County. You go to Kenyatta Hospital and the story is not any different. You go to all our public facilities and it's a sad state of affairs. Yet we have duty bearers. Mheshimiwa, you sit in the health committee. You know, we have the governor who's supposed to ensure that healthcare is there. The president who's there appointing a cabinet secretary who's supposed to ensure that healthcare, whether in the counties or in referral hospitals, that healthcare is present, is provided, and Kenyans are enjoying this right they gave themselves through the Constitution. But look at the cabinet secretary. We've heard him talk about Kiambu, but how long will it take for him to finally say this has to stop? The president has not spoken about it. The committee, I mean, fine, the National Assembly might not have a jurisdiction to handle matters to do with the county, but you can speak with your fellows just next door. You share the same compound at the Senate and petition them on such matters. Why is it the political class, per se, is just quiet? Why?
You know, the unfortunate thing, like you have said, is that sometimes the political class wait so that they can gain some mileage. I don't know how. If you interpret the case of Kiambu, for instance, and where there is an argument that the 12 members of Parliament do not see eye to eye with the governor, and then the hypothesis, therefore, is that they would want to undermine the governor by influencing KMPDU, not return to work. These are the kind of things that you hear. But the question really arises on these 12 members of Parliament plus the governor and whoever else. What would they gain? Today, a family that has lost maybe their firstborn or their lastborn would never reconcile.
Yes.
It doesn't matter what position you hold later in life. It doesn't matter what happens. They will never reconcile with the situation, in their own home. So the question really is, first of all, why would we want to politicize issues such as that? And I'll tell you, in instances, because I have myself experienced this, in instances where the county leadership, from the members of Parliament to the senator to the governor, where they are working together, there is a tendency to have very, 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 very great progress in terms of everything, in terms of infrastructure, whether you're talking about health. And I'll give you an example. When we approached the previous government on helping us to put up Githunguri Level 4 Hospital, the previous government, because we all did as members, members of the leadership of Kiambu County, the national government listened to us and they gave us 600 million, and that hospital is almost up and running. Where they are working together, there is a tendency to attract further investment. Leave about now saving lives, leave about better provision of services. Where the leaders are working together, there is a tendency to have better development and coordinated development. But where they are scattered, that is where we are getting these kind of issues. So the question really is, why should we politicize human life, really? What will you get out of politicization of human life? So there is need. I know you cannot reconcile friendship. Okay, you cannot make people love one another or like one another. But then, of course, if you draw two circles, there is always that intersection. That is the intersection that we are looking at. The other sides of the circles could be your differences. You can maintain your differences, but there's a certain commonality that you have to maintain for the welfare of the society of the people that you're serving.
Okay, at the moment you're looking at Kiambu, there's a deeper issue here. And the deeper issue here is just generally healthcare across all counties. And just give me a minute to just, because we've been talking about Kiambu, we've slightly touched on Nairobi. Nairobi, for example, because I was just looking at figures here since, 2022, but this is more recently, like last year, up to where we are today. So Nairobi County doctors were on strike for 85 days. It affected healthcare in this city. Kiambu, I don't even need to talk more about it because we know what is happening in Kiambu. Now in Kisumu, doctors went on a strike. This is it was over salary stoppage. Then you have Kakamega, nurses called off a planned strike, but they had to get into a deal after a whole month out on the streets. Lamu, nurses strike is ongoing, it's indefinite. Medics downed tools of pay and stagnation. Siaya County, nurses were on strike and there were protests that later turned violent. Migori County, nurses strike was called off after there was a deal, but that took a bit of time. Elgeyo Marakwet, nurses on strike, and the strike ended after a return to work agreement. Machakos County, county services were paralyzed, and the governor even threatened to fire and rehire around 500 more nurses. We're looking at Embu County doctors suspended their strike after talks. Nyeri County is the same thing, striking doctors during national action, local participation, and so many things had to be put together for these people to sit and talk, like Governor Nyoro, you're saying. Trans Nzoia, Turkana, I can go on and on and on and on. All these are all the counties. The list is very long. My question is, let's talk solution. We are looking at county healthcare management. What's the way forward? Because the coming administration will still deal with this. And at the bottom of this are Kenyans who voted for these leaders, who at one point when they get sick, they expect services when they go to these hospitals, and they get none. Politics aside, what's the way forward?
In all these incidences, one of the first trigger are delayed salaries. That is the first trigger, and that is why I am presenting a position that the first thing we need to do, one of the biggest complaints about public servants in county governments are delayed salaries. Let us come up with a policy. And Governor Nyoro, you will remember, after on the onset of the devolution, none of the counties had the structures to pay salaries, except for the defunct local government employees. All public servants for the whole of 2013 were paid from the Directorate of Personnel Management across the nation. And therefore, all public servants received their pay. If there was a delay, it was a delay across the country. Now, these days, apparently, national government employees get their salaries regularly. County government employees are sometimes getting their salaries 3 months late. Can we have a uniform policy on the payment of salaries for public servants across the country? The second area is the question of promotions. And that is not unique to the health sector. If you looked into the issue of promotions in the police force in this country, we have officers who left Giganjo as police constables and served and died as police constables. Primary school teachers, again, another area where stagnation is rampant. In the health sector, another common area of contention is redesignation after I have upgraded my skills. This cannot be left to be a conversation happening in one corner, that is Kiambu, another one in Lamu, another one in Kisumu, another one in Garissa. In our constitution, one of the biggest roles of responsibilities of the national government is policy formulation. Since the onset of devolution, policy formulation in the national government, which is its core responsibility, has taken a back burner. We need to relook at that with a lot of urgency. The second area that has brought a lot of contention is the job designation. I am on contract, I am permanent and pensionable. Until again we have coherence between being permanent and pensionable and being contractual. And a lot of times we keep talking about best practices. Where is the world shift moving to on the area of employment? Do we still have permanent and pensionable employees in the other jurisdictions? And when we look at our resource envelope and put it on the table, then we may begin to see that some of the employment policies that we are practicing in this country will not be sustainable.
But how is it works for a certain group of civil servants? We've had conversations around judges and the kind of pension schemes that they're actually proposing to go even through Parliament. We've had MPs, you yourself, we've never had MPs saying our salaries have been delayed, but you're pensionable. So how is it that you can have a conversation around whether it's permanent and pensionable when it's only a certain group of people, and there are others who are enjoying salaries that are actually at the top if you're to compare with other clusters around the globe?
Let me demystify Parliament. In Parliament, members of Parliament are not permanent and pensionable. You have a 5-year contract that you renew.
But you have pension.
You only become pensionable once you are re-elected for a second term. That is when you enter the pension scale.
Okay.
So your first 5 years are purely on contract with a gratuity like every other contractual employee.
But with a very good salary.
But
You can pay a pension and
Yeah.
tuck some away for later.
that is okay. You see, the question of the salary, and you know, we keep talking about the salary of a member of Parliament, but I urge Kenyans to also look at the job description of a member of Parliament. There's a job description that you have put on paper. There's a job description of the people who have employed me. If I opened my phone this morning, I can assure you.
Oh, I know where this
I
conversation
can
is
assure
going.
you. Wait. I'll just mention one. I'll just mention
You know
two
what
things.
you are?
I can assure you, I have a family, I have a mother who has sent me a message that my children have slept hungry. Despite the fact that I am a member of Parliament, legislating, oversighting, the human part of me is such that I will have to think about this family. I have a parent whose children are at home, Form 4 kids, yet I have already given the bursary, and for all kids, and especially those in Form 4, I made sure the money went in the first term. How do I deal with this? There are the demands.
How about ensuring that you push for capitation to get to schools early?
I want to chip in here. I think, Weshimura, if we go that direction, we are going to open a Pandora's box.
Yes.
A can of worms. You know, look at doctors. These are people who have gone to school for 7 years. 7 years. I don't know who else in this country has gone to school for 7 years. And then you are sent to a particular location where there is no job graduation, where there is delayed salaries, the level of compensation is way below. You know, it is easier to resign from being doctor than become member of Parliament or become a member, an MCA, and become whatever. So when we look at these issues, I think it is necessary to say that we may probably, as a country, needs to look at what a job entails and the compensation that goes with that job.
Okay.
Unfortunately, we haven't done that, and I want to say that in matters of health, and you talked about judges and you talked about public servants and whatever, there has been a bit of discussion on whether it is necessary to have a health commission. Okay, a health commission that rationalizes all these medical staff across the whole county, so that one doctor is not paid one level of salary in Bungoma, but the same equivalent or classmates in Kakamega, they are paid differently. Whether that can be the solution, I don't know, but it is necessary to look at the skills, to look at what these people have gone through, and then give a compensation that compensates that level.
Dr. Nyoro, the things that you talk about in other jurisdictions are ring-fenced by law. And in order for those laws to come into existence, there is a body that is required to make that law. And so when that body makes the law, I'm sure I'm preaching to the choir. When that body makes the law, it then becomes something that people are bound by to do. It's not a suggestion. It's not something you do when you're feeling a certain type of way on a Wednesday. You do it. So if we've already established, that certain things are required, we have seen the replication of these mistakes year in, year out, administration after administration, whether it's at the county level or whether it's at the national level. By your own admission, Parliament, the National Assembly specifically, was unable to make a law because there was no support. So one has to ask the question, who do members of Parliament represent? Because it would appear as though who they represent is themselves. To make a law that would ensure that you stay as public and state officials within the health system, because one of the things that would happen is that you would ensure that it works. If everybody had to practice and operate within that system, guess what? It would be stellar in its operation. If every single member of Parliament, every single state and public official was bound to send their children to schools within this country, the system would be stellar in its operation. But members of Parliament won't make that law. So the things that Dr. Nyoro is talking about are an impossibility because it doesn't happen at that level. What is it going to take to say the lawmaking body, given the sovereign power of the people, to then represent, make law, and spend money, is actually doing that thing which is going to benefit the people? That's where the answer is. How are we going to make sure that happens?
Let me first pick something that Dr. Nyoro said. The Salaries and Remuneration Commission has done some work around job description. And when we crafted the Constitution and created the Salaries and Remuneration Commission, it means that as way back as before 2010, the desire to level the playing field on matters salary was already with us. And therefore we need to revisit. I don't know whether there's an act, this SRC Act. Right now, I am sitting in the National Cohesion and Equal Opportunities Committee. After our visits around the country on matters national cohesion, we have agreed and we have a draft new National Cohesion Act in Parliament. So is it time to review the Salaries and Remuneration Commission and remove everybody else? This Health Services Commission, Teacher Services Commission, Police Services Commission, and so that we can have uniformity. As long as we will, now we feel the teachers have been on strike more times than doctors in this country, yet they have always had the Teacher Service Commission. So where again is the disconnect? On legislation, and I hope Kenyans listen to me carefully here, we have given Parliament the power as the only body that can legislate. But when we have legislation that is in public interest legislation, and Parliament fails, is it time to create a pathway for the public to push through legislation, and parliamentarians have no choice than to enact it?
What does that mean?
Recall.
No, I want to. You are.
You see,
I don't know.
let me tell you why I have gone that way. IPPG, it was 1997, right? It was negotiated out there, and Parliament was literally bound to pass it. Thereafter, the drafts, Bomas draft, Naivasha draft. Eventually, by the time they came to Parliament, Parliament was bound. Is it time to create those kind of pathways formally, not because of political expedience at particular times. That there are issues that are of such grave national importance that we would compel Parliament that this registration has to be enacted.
One would argue that with the laws that we have today, if the legislative bodies decided to just do their job, to just do everything as per the law, we would not have to go the IPPG or the Bomas draft. If everyone just decided to stick by the law and implement the constitution, Kenya would just be a better country. So one would say, maybe they don't care.
You know, the irony, and I follow Mheshimiwa's discussion, the irony of what he has gone through, all the strikes, and whether teachers, whether airport workers, and whatever. The irony is that when there is a signing of return to work formula, they are paid, and most of the conditions that they were striking against are met. So the question I have is, why do we have them to wait? Okay, we lose lives, we lose services, and then eventually
you still pay them.
You still pay them anyway.
Do it at the
It doesn't make sense at all. Two, I think there is a tendency, if you observe this country, there's a tendency over the last 4 years or so for the number of strikes to increase. Okay? If it is not the teachers, it's JSS teachers. If not JSS teachers, it's the nurses, it's all across. Why? There must be a reason for that. Probably because they see we only get what we are asking for when we strike. Okay? Therefore, we need to preempt some of these by creating an environment where we can discuss, the first question that you asked, how do you preempt this? We can discuss, because eventually you will pay anyway, and it will be more costly because of the opportunity cost of what has happened. So I think we need definitely to observe that and say, what is happening? Why do you have to strike and then later on you come back? Those are issues that we need to look at. And then, finally, I think we need, I have worked for several international organizations, and what those organizations have is what they call the disaster plan. They don't call it the disaster plan, but they have a plan in case this happens. One of the plans, for instance, for an organization that I worked with, is to say, if this house is on fire, will we be in business? So what can we do so that we are in business? And we used to have like an alternative office where there are checks and whatever. At that time, electronic monetary, whatever was not common. Now, we also need to have that kind of a disaster plan, that in case there is this kind of disagreement, and to avoid losing so many lives, we as government will undertake what is the arbitration process. Is it churches? Is it professionals? Is it who? We should have that as a country, so that when that happens, you switch on that button, and if that button now can lead you to switching another button, then within a very short period of time you have curtailed this. But we cannot continue with the situation as it is.
But Governor, that can't work. If these same very people, if they just sneeze today and they suspect they have a flu, they will not go to Kenyatta National Hospital. They will fly to Germany. They will fly to Dubai for treatment. And they will post pictures how they're being visited by their fellow politicians in a hospital in Germany. And these are people who have been leaders and are leaders in this country. We look at education. The reason why they will not feel anything is because their kids are studying in Australia. They're in the UK. They're in universities in America. But lecturers in Kenya are on strike. So because huyu ni mtoto wa maskini, nobody cares, because their children are graduating in universities in Europe. But they don't care whether the lecturer here strikes or not, because that's the only language they will understand. People have to either go to the street protest. They know, and like I said, I was saying, these things are clear in the law. SRC is very, very clear. The mandate of Parliament is very, very clear. And as we say, the law is very, very clear.
And you see, Okari, the saddest thing, or the irony of it all, is you fly out of the country to go to Germany to go to a public health facility. You're going to someone else's home who has made sure that their systems and processes are working. Your responsibility back home is to ensure that your responsibilities and processes here are working so that the people get to enjoy that. I remember a while back when a certain governor left the country to go to Germany to get treated and was saying, yeah, I went to Germany to get treated, yet you are a governor who's in charge of a health function in your county that is not.
His own doctors are on strike at that time.
Yeah.
And he can fly to a different country to get treatment.
That's our reality.
Today, and I have only been a first-time member of Parliament. Mm-hmm. Fortunately, I have served in the Health Committee throughout. The current leadership of the Health Committee in Parliament has one of the most people-centric minds among the leaders that I have come across in this country in the name of Dr. Nyikao. Largely all his life he has practiced medicine. He has been a director of medical services. He has been a PS. And now he's a legislator. The commitment that I see in the leadership of the National Assembly Health Committee on making UHC work is impressive. I want to appeal to us as Kenyans, and I want to begin with us as leaders to recommit ourselves to making things in our country work.
How?
Today, if I am in Nyeri, the best consultants available to me in Nyeri are actually all employees of Nyeri County government at the Nyeri County Referral Hospital. But because I have the privilege of being able to reach each one of them on phone, and they can see me, and they can even give me a prescription, and tell me go to this facility and get this, go and get this test done, even when they are not in the country. I do not ask myself, what about the rest of Nyeri residents who do not have this privilege? What should I be doing so that they can even just enjoy half of what I am able to access?
So it seems like what you're saying is that it's not Kenyans who need to revisit this call to make things work. It's the individuals who've been put in a collective duty and responsibility to make it work.
You cannot put it better.
Kenyans are trying to work this thing every single day, but the people that they have delegated their power to are the ones who are feeling them every day.
In the health sector, my call for Kenyans is on pooling of resources into the bucket that will pay for services. And here, for you and me who has a pay slip, we have no choice. For the rest of us, and we were having this conversation, we say the informal sector. And we asked ourselves, the guy who owns a chain of hotels in Mombasa as a director and does not pay themselves a salary, what are they according to payment for social health insurance? They are in the informal sector. Mm-hmm. Are we accepting to pay our due? And the guy at the lowest level, is he also accepting to pay the 650 after going through the means testing? The conversation around the improvement of services across the board has to be matched on the other side in making sure that the basket from which these services are paid for has sufficient resources. The second area is the issue of corruption in our country. We are all guilty. Because on one side is Madenge receiving, on the other side is the person giving. And the solution to corruption in this country is one simple decision, that if all of us decided that we will not give bribes, it is a collective responsibility that we can make as Kenyans. If we agreed we do not need to give bribes, all these efforts we put into anti-corruption would not need to be there. So there is a need for us to shift our settings as a nation, even as there is a greater need for those of us in leadership to also shift.
You know, this corruption conversation at the very top. If I, as a Kenyan, today, I leave this studio,
Yes.
and I want to walk into a hospital and I want to find a bed, because there's a time we took a patient to Kenyatta National Hospital, and I discovered you actually have to bribe the insiders to get an ICU bed. They're actually on sale. So if you're just coming and thinking you'll get a bed in ICU HD, you may not. You have to give out some money. If the systems worked for me as a Kenyan, I want to walk into a police station to report an incident, and I want to get a police officer to come to where I live. And I'm forced to bribe. If the systems work, I will not pay for any of these bribes. So when we talk about corruption in this case, if the systems worked, if you did your job, if everybody did their job, where will we talk about bribing? I don't need to bribe if I can actually get access to services or getting things done in a government office.
You know,
one point. When Kibaki took over the presidency, within weeks of being sworn in, Kenyans arrested police officers who were taking bribes on the road. Who stood to tell Kenyans that collectively we can stop it? The issue of Kenyatta National Hospital. When there was this declaration that if beds were in public hospitals were not registered with KMPDC and you were admitted in hospital beyond the capacity registered, SHA would not pay. I took time to go and camp at Mount Kenya Level 4 Hospital in Nyeri that serves my constituents. At KMPDC, they were registered as having 24 beds. When was that registration done? When Mount Kenya was a sub-county hospital. It took me to go and sit there, call the CEO of KMPDC, call the CEO of DHA, and call the CEO of SHA to get the numbers reflected in those bodies as 53. Because the previous night, I had people from the slums called Wetemere who had gone to that hospital. They were told the capacity is full, but if you can pay from your pocket, you will get a bed. I told them, sign that document that you will pay. But on Monday morning, I will be there. It was on a Friday night. On Monday morning, I will be there to make sure that those beds are upgraded. Why did it need me to go and sit in the hospital at Mount Kenya?
Because of the system that Dennis is talking about that is so corrupted,
So
that requires
now,
the same system
and
that allows you, Mweshimiwa, to make a phone call to a doctor and he sorts you out, that many other Kenyans don't have the privilege of doing. It's the same system that demands that when we see a representation of power, that is when we somehow start to act. Meanwhile, there are people in their thousands who are thronging into those facilities and don't get the attention. It's the system that Okari mentions that is fostering that. But if the system was working, it wouldn't matter whether it was James Nyoro who walked in, or Dennis or Aseto who walked in, or the person who is manning the door, or the person who's sweeping the street. If the system worked, it wouldn't matter who walked into the doors. Everybody would be treated the same.
I think for me the issue of corruption.
You had asked on Kenyans. Allow me to finish. You had asked on my call to Kenyans. The demand for systems to work has to be our collective responsibility, and we must not tire to insist that these things work. These conversations are key. Sometimes we are accused of, we only see him on TV articulating these issues. Unless I am here, Kenyans can never hear my appeal. My fellow leaders can never, hear my appeal. We have become quite expressive. But I am desiring for us to pick one thing and push until it is done. On the health sector, it is time collectively for all of us. And I've called my fellow leaders, those of us who keep running to Nairobi Hospital. There is a day you will run under the present circumstances. If nothing is done, there's a day we will run into Nairobi Hospital and you will be no different from the person who has gone to Mamarusi Kibaki or Bagadi.
Indeed, the problems in Nairobi Hospital have to do with corruption. You are talking about. If you look at what has transferred in Nairobi Hospital over the last 1 year, and who wants to be chairman and who wants to be a member of Kenya Hospital Association so that you can elect somebody who has zero knowledge on medical issues to be chairman, it's all about corruption. So corruption is a subject that is beyond the current issues that we are discussing today. It is deeply entrenched within the fabric of our society. And I agree with you, we need to start from somewhere. But it's like they say, the fish starts rotting from the head.
Yes.
So we need to start from somewhere. But back to this health issue, and I'm very happy that you are in the health committee, Mheshimiwa, and you've talked about Nikal, whom I respect a lot. He's very, very knowledgeable, even through his days as Director of Medical Services and so on. But the question I have for you is, and I know there are teething problems in the rolling out of SHA and SHIF, which eventually will be there. I was in charge of Rockefeller Foundation universal health coverage. And that time in Africa, there are only a few countries. I think Rwanda was the best, South Africa. But we were running a lot from Asian countries, Thailand, Singapore, and so on. It takes time for universal health coverage to work. You need to pull in resources from those who have so that it can benefit those who haven't. But it requires a very well spelled out strategy. It requires that you work with the people. It also requires forward thinking. Why would you, for instance, wait until an unfortunate situation of cancer patients are demonstrating to the CS Health? Cancer patients, they are supposed to be in a hospice. They are supposed to be under care. Why would we wait until HIV patients are demonstrating because they are not getting services? Is it that your committee or whoever was looking at this did not anticipate that certain groups need to be considered and that they will have to suffer for them to come out to be incorporated? And that is forward planning that I'm talking about. We need to do a lot of forward planning in order to preempt some of the situations, even as we roll out UHC, because we will be there in the next 5-10 years. I'm very, very confident that UHC will be working. But it has to work with the people, and we have to anticipate the kind of problems that we are saying. The same way I'm saying, anticipate that there is going to be a strike. What are the 3-4 things that you plan so that you can overcome the problem before it becomes such a a giant thing. These are really the issues that we as Kenyans need to start talking about and thinking about.
Indeed, and as we put them out there, necessary for us to. We've talked quite some about some of these things today. If anything, put them out there for us to be aware of the reality of the day. And it is our hope, Mheshimiwa, as you go back to deliberations at the Health Committee, that some of these things are actually pushed beyond talk. And, for us to then put them out there and say, look, it's necessary for us to look into them. But we want to thank you, both of you, for joining us this morning. It's always necessary for us to not hide these things under the carpet. Dr. James Nyoro, former governor of Kiambu County, as well as Member of Parliament Nyeri Town, Duncan Mavenge, as well as the member of the Parliament Health Committee. Asante Sana for being here this morning. Thank you so much. It's 26 minutes to 10. We'll be back. Phone calls from you telling us what your thoughts around it and what needs to be done. We'll do that as a phone call edition of Spice Baraza. We'll do that when we come back from this break. Good morning at 26 to 10.
The following takes place from 6 a.m. to 10 a.m. every weekday on Spice.
This is the Situation Room, the only way to start your day.